Hello, this is John Borzilleri. This is the third of 3 initial videos I have made for this website I have started called Drug Price Truth and a related YouTube channel, Facebook page, with the goal of informing and hopefully engaging the American public about the remarkably simple but secretive scheme I uncovered a long time ago now, which is at the origins of massive U.S. brand drug price increases over the last 10-15 years. Okay? It's a simple scheme in which the drug companies have been secretly paying the insurance companies a percentage of each and every massive sticker price increase on drugs in this country without telling anybody, both making an enormous amount of money and passing the costs on to us. Right? And these payments have been primarily made to the 4 dominant insurance PBM companies that control 80 to 90% of the pharmacy market in our country, including the Medicare Part D program where this began and the private insurance market. Okay? And those 4 companies are United Healthcare and their Optum PBM division, CVS and Aetna, which recently merged to make this worse, Cigna and Express Scripts, which recently merged to make this worse, and Humana. Okay? That's a simple scheme. Right? And while they've been doing this, secretly being partners, they've spent an enormous amount of effort in the last bunch of years as the crisis has escalated to do this blame game back and forth, blaming each other, and we're both doing the right thing and they're not, while in reality they've actually been partners. That might even be the worst part of it in some ways. Okay? All right, so I'm going to show you the magnitude of harm with a bunch of products from the 2 whistleblower cases I filed about this a long time ago, starting in 2014. And remember, I figured this out. I'd never heard of this before. As a professional analyst, I figured this out in the middle of 2013 and then went to a meeting where I had heard 50 to 60 pharmaceutical executives, insurance executives, they're lawyers and consultants that work in this secret place. Never heard about this before, and they discussed it openly, admitted the whole thing. Right? Remember, before Part D, these PBMs made all their money by negotiating for discounts for us, keeping part of it as profits. Secretly, when Part D began, they transitioned to this entirely new business model where the drug companies and the PBMs began partnering to raise the prices and paying them in a new way with these fees tied to the massive price increases. And this transition happened because of severe threats to the pharmaceutical industry. A lot of things went off patent, they had little growth, bad pipelines. Okay, and they were able to use this loophole. Okay, all right, that's it. Okay, remember, I'm going to give you specific examples from the cases, what I call the worst offenders. This has been a systemic scheme. Almost every story you've read out there about brand price increases massively increasing in the last 5 or 7 years, this is at the center of it in almost every one. EpiPen, things like Pharma Bro, the guy who's in jail for stock trading. Okay, Valiant Pharmaceuticals, most everything else, okay? Those are actually smaller companies. Much, much more harm has been done when this began earlier with big drugs, big drug and biotech companies that faces severe competitive challenges that had no growth without price increases, okay? And those are the ones that I focused on in my whistleblower cases that I filed with encouragement by the Justice Department a long time ago, okay? I thought it would be a quick investigation. Unfortunately, it didn't turn out that way, despite massively increasing evidence and harm. The government didn't take the cases, and even worse, they blocked me from doing it recently by getting the cases killed in the court as I was making good progress. An interesting experience, and I will talk more about in the future. Okay? I'm going to show you some charts now. The first case was filed in the multiple sclerosis market. Again, the common characteristic of all the drugs I target in these cases are ones where the abuse is obvious to me and most severe. Cases where the drug companies are reporting massive increases in sales, right, for products, major products, while the usage of the drugs is plummeting, right? Driven entirely, obviously, by massive U.S. price increases. Okay, and these are not debatable numbers, by the way, I'm going to show you, because these are the sales reported by the actual companies. And the prescription data is public information that all people like me, professional analysts, follow every day. That's important information, right? This is not debatable information. Okay? So massive increases in sales, right? No one's using the drug, most of the drugs in these cases, the usage is down 40, 50, 60, 70% over a decade since Part D began. And the PBMs, these dominant PBMs, are being paid a percentage of the sticker prices as these are going up. So they're getting paid a lot more money for doing a lot less work. And for some of these products, 5 or 10 times as much money since Part D began for doing half as much work. There's nothing subtle about the abuse, and the laws about these fees, which are supposed to be for legitimate work for patients, are very clear. So that's why I targeted these products, okay? The ones that have the most impact. Okay, now I'm gonna start showing you some stuff. Okay, again, this is all in the whistleblower documents that are on this website. There's links here. I'm just going to show you the pictures because I'm not a tech guy, all right? You can look at them more close up and personal. They're pretty shocking, I believe, okay? I filed the first case January of 2014 about the US multiple sclerosis market, where this was really, really bad at the beginning, right? Remember, drugs, when this began, before Part D, MS drug prices in the US and Europe were the same, all of them, about $10,000 to $15,000, right? When I filed this case, initially, early 2014, uniformly, all the prices in the US had gone to the $50,000 sticker price range. Europe, no change at all. Nowhere else in the world this is happening, right? We're the only place that has pharmacy benefit managers, okay? Okay, that's when I filed it, okay? It's gotten much worse since then, you know? Now, $100,000 in the US, and they have barely budged in Europe. Okay, here's the chart. Most people get really sharp by this. This is in the thing. This is the pricing, right? You can see it. Hockey stick. Hockey stick of massive increases in MS drug prices starting right when Part D started, 2003, 4, 5, 6. Hockey stick up to $100,000 in the US now, barely budging in Europe. Okay? All because of this straightforward scheme. And a couple things to keep in mind here. When this started, MS was a very, very mature category, been around since a long time, since the mid-90s. All right? Already mature, quite competitive. There were 4 very similar products in the market, right? Now there are 12 very similar products in the market in the US, and they all cost a lot of money. Competition not working, obviously. Okay? All right. But at the heart of my cases are the worst offenders. The old products in MS, back then, that were facing severe competition and dropping like a rock. Those were raising in price too. Step back for a second to people out there. Forget about the drug industry. Anyone out there with a business of any kind, doesn't matter what you're selling, forget about a drug. You're selling any kind of a product, and you have a product that people aren't using anymore. Do you get to raise the price? No. That's when you cut the price usually to get market share and people to use it. Or you're in trouble, or you develop a new product to make up for that, okay? That's what happened. All right, you don't get to raise the price. Never mind what has happened here, where they've been massively raising the price tenfold on products that are dropping like a rock. There's nothing subtle about this, right? So what has this meant over the last 10, 15 years with some of these products? I'm going to show you the first chart, which is Biogen's Avonex, right? Old product, launched in 1996. Here's the sales chart for this from the company itself, from the prescription. This is the chart of Biogen's Avonex, all right? The black is the sales without price increases, right? And you can see, I'm sorry you can't read this, but back in 2005, it had sales of about $900 million, right? The usage of the drug is down 60 to 70% since then, which means there are 60 to 70% less people on this drug now than when this scheme began with Medicare Part D, right? Without massive price increases from $10, $12 to $100,000 list prices, sticker prices, the sales would be less than $300 million in the United States at the present time. Instead, you can see the gray of what Biogen has actually reported. Sales in the $2 billion range, right, that have finally started to flatten off lately, right? All due to massive price increases, right? And the PBMs are getting paid on that sticker price. So getting paid an enormous amount of money for doing less work. Now you wonder how much harm has been done. That gray area there, right, is the sales that have happened purely due to price increases in the US that never should have happened. just to sum that up, that gray area is more than $12 billion for this one product since Part D began to the present time, and increases every day. This is going on. All right? All right? That is the kind of harm that we are talking about just for one product. Okay? Give you the second product in the MS space. Old product, right? Same kind of dynamic. Facing severe market share losses, decreased use because of competition in the US, right? Price is only going up in the US, right? Copaxone. This is even bigger because this is a bigger market share product, right? The black is the sales without price increases, right? This is about an $800 million product back in 2005 when this began, right? Same thing, price is going from $10, $15 to $100,000 in the US. No change in Europe, right? The black is the sales if they didn't have price increases, right? This is reported by Teva, right? Biggest product they have by far, most of their profits. Okay? Sales would be $500 million range now without massive price increases. Instead, they consistently reported $3 billion in sales recently, despite generics being available and all of that. Okay? Remember, generics don't have an impact in this kind of market now because the discounts don't matter. What they're really going for are these fees tied to the list prices for the PBMs. Okay? So this is my MS case. Same kind of charts you'll see for the other products in there, same amount of harm, right? So you wonder, when you add all this up in this market, there has been many, many, many billion dollars of harm, lots of products that never should have happened because this is a very severely competitive category. And if the PBMs were doing their job, right, none of this should have happened, right? Just like the prices didn't go up in Europe. Okay, and then you see the cases, the cumulative harm in this MS drug case over 10 to 15 years, you can see individual products are enormous, more than $60 billion, just for a bunch of products in the case, like 7, 8 products. All right, just so you know, about 30–40% of the MS market is in Part D, mostly disabled patients that came over from Medicaid, that were put into Part D, transferred to it when Part D began. The rest of it's in the private insurance market. Right? This is the kind of harm. Now, I'm going to give you some examples. Okay, I filed this case for the government January 2014. Unfortunately, investigation didn't go well. And I started pushing back. I then ended up filing another case in another place, hoping for a better investigation, because it was getting much worse in lots of other drugs, right? As we all know. Insulins, rheumatoid arthritis drugs, cancer drugs, lots of old drugs. Again, same dynamics, right? I focus on the ones in the same dynamics. Massively increasing sales by the drug companies, right? And declining use of the drugs. All price increases should not be happening, right? Okay, so I'm going to give you a couple examples from the second case I filed in the Southern District of New York, October of 2015. Again, the harm has gotten much worse now compared to when I filed these cases in October 2015 because the prices on virtually every drug in that case have doubled again. All right, first drug I'm going to show you, one of the biggest selling drugs out there, Amgen's Enbrel, arthritis drug, right? Again, good product, launched in 1997. Product sales back then in the US were about $2.5 billion. The use of this drug, because of increased competition, lots of other similar products out there, right, is down about 25% since Part D began 2006. Yet, Amgen has reported this is one of their biggest products, massive increases in US sales. I think the latest is near $6 billion, okay? Without the price increases, the sales would have gone down, to less than the $2 billion range now, okay? Okay, the scale is a little bit different here, but the scale of that, just so you get a sense, is about $19 billion of sales, that gray area, that is only attributable to price increases since Part D began. In the US, again, same in Europe. These prices have not budged in Europe. Okay, $19 billion, again, probably about 35–40% in Medicare Part D, the rest in our private insurance plans. Okay? Second product I'm going to talk about from that case, Gleevec. Very controversial product. A lot of doctors talked about this years ago, right? This product is now generic. Okay? This is a great product. Gleevec is a wonderful treatment for a rare form of leukemia, right? Launched in 2001. All right? It had sales of about $500 million range in 2005, just before Part D. Okay? and it cost about $30,000 back then, right? Unfortunately, it faced a lot more competition. Novartis launched another drug. Bristol Myers launched another drug that had some advantages, started taking market share, so the growth of this product started really stalling. It was only up a little bit over the next bunch of years and then started declining, all right? So the only way for Novartis to grow this, one of the most important products, after lots of patent expirations, was to raise the price and give a cut to the PBMs. So that's what I began doing. When I filed this case in October 2015, the list price of Gleevec had increased to about $80,000+ per patient in the US. And just to give you a hint, there's virtually no rebates on this kind of drug, right? Now when it went off patent in early 2016, the price had increased further to $150,000 a patient in the US. Imagine the harm of individuals facing that, trying to come up with a portion of that bill, right? The sales of Gleevec would have gone from about $500 million to a little north of $600 million without price increases. Instead, they consistently, their final year of the sales before generic were $2.5 billion in the US. Again, all that gray area is due to massive price increases that did not need to happen, right? Severe competition, okay? That in this drug, right, compared to the other drugs, cancer by definition, 65% or so or more Medicare Part D program, right? Unfortunately, as we get older, cancer happens in the elderly, right? Massive harm in Part D, but also in private insurance plans. Lots of stories out there about people trying to come up with money to fund this. All right, that's cancer. Diabetes, right? Lots of stories. People really being harmed. Young people going to Mexico, right? Doing without their insulin, okay? This is the biggest insulin drug called Sanofi's Lantus, right? Just so you know, this was the top-selling drug in Medicare Part D for a number of years, right? Good drug, right? A once daily insulin, right? Okay, just not launched that long ago, okay? It had sales of less than $1 billion, right? It has grown, right? Until a few years ago. Without price increases, fivefold, whatever they've gone up, the sales would have been peak, a little less than $2 billion. Instead, the peak sales were more than $6 billion. It started to come down because of all the controversy in insulin, right? Again, lots and lots of this in Medicare Part D, but also in the private sector. People facing severe crises. Again, none of this should have happened. Competition in insulin is quite severe. Okay, all due to them giving a cut to the insurance companies in this secret new way. Again, all began with Medicare Part D. I'll show you one other in the insulin market to give you a sense of how severe it could be, right? So this is an insulin from Eli Lilly called Humulin, an old drug that's been around a very, very, very long time, right? 40, 50 years, whatever it is, right? This product, sharply declining use, 40-50% decrease in prescriptions since Part D began, and yet Eli Lilly reported sales have increased from $400 to $800 million. This is a heavily used drug in Medicare Part D, right? So rather than sales going down 30-40% legitimately based on the use of the drug, they more than doubled. So all that gray area is growth, is massive harm. Hundreds of billions of dollars over the last bunch of decades, okay? All right, so you get a sense. I filed these two cases. The cases involve 22 drugs, the worst offenders. Same pattern, massive increase in drugs mostly, sales, declining use. PBMs getting fees. Then you ask, okay, how much do the PBMs get? A lot of secrecy around all this. Finally, the lobbying group for the pharmaceutical organization put out a report in 2017 what the average fee rate is for high-cost drugs. What are called specialty drugs like MS drugs, rheumatoid arthritis drugs, cancer drugs. And they put out that the average fee rate is 8% paying to the PBM, these dominant PBMs. That doesn't sound like so much money until you factor in these massive price increases and consider that unlike rebates, they keep all this money, right? They like to tout now, well, we give all the rebates back. Yes, they do, because they don't matter anymore, right? They're not making money on them, they're making money on the fees. So you use the example of a multiple sclerosis drug like Avonex. Price has gone from $10,000 to $100,000, making virtually no money on fees back when it wasn't really part of the business plan. Now, 8% of $100,000, right, for an MS drug. That's about $650 to $700 per monthly prescription for a very old drug like Avonex that most people are on for many years, a chronic drug, right? Then you think, well, what are they doing for that money, right? And I've had lots of conversations with doctors about this, right, and patients. And I will tell you that the conversations are kind of interesting because most people start off with, I say, well, what is the PBM doing for you as a patient or your patients with MS? And they say, and the first half the time they say, PBM, what's a PBM? Okay, that's how good they are keeping secrets. Right? But then when you say a name, Express Scripts or CVS, they know what you're talking about. And they say, well, they say they're helping with all these patients doing all this clinical work. And they usually like, what? You know, what are you talking about? We take care of the patients. The medical staff and my nurses, right? We take care of the patients, right? I don't know what they're talking about, okay? So that's the other thing. Other thing to keep in mind is with these high-cost specialty drugs is that nowadays these 4 dominant PBMs have taken full control of the market. So in a big way that how they've done it is through mail order. 85% of these high-cost specialty drugs, MS otherwise, come to your house if you have that disease, and people who have this know this, by mail. Right? You don't pick them up at your local pharmacy. So what that means is that it's coming from like an Amazon specialty pharmacy. They have very little, if any, direct contact with patients. You know, a lot of these patients, MS, cancer, rheumatoid, these are complicated patients. You can't manage them over the phone. They might lob in a phone call about a refill that everybody gets or you know, something. But you don't manage patients from afar, complex patients. They're managed by doctors and nurses and their staff. And that has come very clear from conversations with doctors. So then think about it. 8% of $100,000, because it's on the sticker price, right? Potentially in the range of $700 a month for what? And I've concluded, unfortunately, in a lot of cases, especially for these old drugs, right? It's mostly for mailing the prescription. That's a lot of money. Okay? And it's skyrocketed with the prices. Remember, $0 to $8,000 a patient, right, over the last 15 years. Now you have to think about it in aggregate for all these products like Avonex. Skyrocketing sales. No one's using it. So overall, these PBMs are getting an enormous increase in money. And for these, simple math, 5 to 10 times as much money for doing half as much work, right? Legitimate work. And I like to compare it just to having someone do a service around your house. Having someone cut your lawn or paint a room in your house, right? 10 years ago, they paint your room for $100. They come back, they tell you, now we're going to paint your room for $500, $1,000, but we're only painting half the room. You just laugh, right? And they say, well, everybody, all the other PBMs are charging the same money, right? That's what you have to pay. Yeah. Big difference in all this, though. In drug land, right, where both sides of this transaction are making a lot of money. Drug company makes most of the money, PBM gets a big cut, and we pay, either in Part D and taxpayers or in our own private insurance plans. This is what's been going on in the grand scale. When you sum this up, right, over 10 to 15 years, lots of products. I filed the cases on 22 big products. 11 drug companies, the big 4 insurance companies. I told you how individual ones can be $10 to $20 billion. It's ridiculous over 10 to 15 years. It adds up to billions and billions, $175 billion now or so. It was less than half that when I filed these cases. The harm is accumulating worse every day. Okay? Keep this all in mind, right? Also, when I started this, I'm a doctor. This is about people, right? Think about the individual people. Most of us are healthy. We don't have these bad diseases, knock on wood, but we could any day. Think about people you know, people you don't know, who have cancer, multiple sclerosis, rheumatoid arthritis, lots of severe diseases. They get a bad diagnosis. They're on these drugs. Prices are skyrocketing. They could be on the hook for big money for this. Their families going bankrupt. Think about that. These people, usually at home, right? Those are the people to think about. Those are the people I think about when I started this, and that's who I think about now. Okay? We're all in this together. It's affecting all of our drug costs, but these people, you know, we're in this together. And it's not politics, okay? And it's not about the drug industry. This is a centrally controlled scheme. It's been my privilege to deal with people in the pharmaceutical industry, researchers, for many, many years, going to medical meetings. It's been my privilege to deal with some people in the insurance business, right? 99% of the people in those industries are doing a wonderful job developing new drugs and stuff. They don't know anything about this. They're victims just like the rest of us. The key to a scheme like this is keeping it secret and very centrally controlled, right? It's not vilifying the drug industry. It's a wonderful industry in a lot of ways. And I'm not vilifying the insurance industry, okay? This is centrally controlled, okay? Anyway, goal here has always been the same. Stop this. I'm a physician. Please, just share this information. Get in with. There's going to be a lot more. I've been at this for 6+ years. I got lots of things to tell you. Lots of things have happened. All right? Just share this with friends and family. Get on the mailing list. I will tell you something. They've got after me personally. Don't worry about that. I can handle that. I don't break laws. Okay? I'm trying to stop something. I can handle that myself. There's a lot of defenseless people in this country that can't help themselves. That's who really matters. So just share this with your friends and family. Hopefully we can do it. We can get there. Add on the mailing list, share your stories, right? I will never ask you for any money. You'll never see a donate button. This is about stopping this, okay? That was my obligation from the beginning. It remains mine. I hope you share it with me. Thank you very much, okay, for watching this, and have a good day.